Kids are boys.
Mhm.
Oh, wow.
That's why I
So,
look like
so
this.
that's either payback or, yeah.
Good afternoon. We'll call to order the Health and Human Services Committee regular meeting, although it's at a regular date. We thank you for your flexibility. Today, October 29th. As far as our roll call, we are all here with Marietta on Zoom. Affidavit of posting was posted accurately. Let's rise for a moment of silent prayer and the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Right. Any corrections or updates in the minutes? Hearing, seeing none, we will accept them as approved then. All right, our first agenda item is, I gotta get this off my screen, is the economic support update. And we have Julie.
Yes, great. Thank you so much. So we have two things to discuss with you today about economic support. The first being sort of a comprehensive report that's in your packet with some spreadsheets and information. So as you know, there was the HR 1 OBBBA, the one big beautiful bill that was passed earlier this year. And in that was some changes in how the federal government is going to fund the administration of SNAP or food share. Currently, the federal government provides 50% of the cost of administration, and the state provides the other 50%. And so the change, which will go into effect in October 1 of 2026, which aligns with the federal budget year, is that the federal government will only be providing 25%. And so obviously that's a significant amount of money that the state will have to absorb for the administration of the SNAP benefit. It is unclear at this time whether they will or will not pass that on to the counties or not. At this point, the Department of Health Services is proposing to the legislators to fund it at the tune of $69 million. So unclear whether our state legislators will approve that. And so I would say over the next year, it'll be a wait and see for us of what that impact will be for us. One thing to note is, as we presented our budget at our last meeting and in the next county board meeting, you'll be looking to approve that. This potential change is not in that budget. So as we learn more about what the state intends to do and what the federal government intends to do, if we are looking at about $104,000 deficit in our operational spending, we'll need to come to this committee with a solution regarding that. But we are in a wait and see. So I wanted to bring this to your attention so that you were aware that this was going on. The other thing that's important to know is that part of the HR 1 was that states who have high error rates in their benefit determination will be required to contribute to the cash portion of SNAP. And so it's very important for states to maintain that low error rate because otherwise then the state will be on the hook for that cash portion depending on how high their error rate is. And so one of the things that we'll have to look at very closely if we are needing to absorb that around $4,000 loss is whether or not we can make any impact on staffing, because we don't want to reduce staffing when the workload is increasing around assurance of error rate, because then that will may be more money that the state will have to pay out, and usually then that is passed on to the county. So I will stop there with that item and see if there's any questions that that the group has.
Supervisor Bossert.
So with this SNAP program, obviously we want people to get relief when they're in a situation, say they're unemployed, so that they can make sure they can feed their family. But a concern I have in general, and I don't know to what extent the county can even control this, does this program allow for benefits for people who are not in this country legally?
So you are not eligible for SNAP benefits if you are an illegal immigrant or an illegal person.
All right, perfect. Feel like I had one more, but yeah. I can't think what it is, so.
Okay,
Yep.
thank you. Anyone else? Supervisor Gallus.
Yeah, Mr. Sko, what's the definition of error rate?
I'm going to ask Renee Zagel, who's our division manager, to come up. She has all of the intimate details.
Obviously, that's going to be key, and whether that's, re-education or best practice implementation of caseworkers, whatever the term is, to ensure that there are no errors or minimal errors, presumably maybe to reference to Supervisor Bosser, is someone receiving benefits that shouldn't be, and presumably that's an error rate. Or at least that's how my mind would think of it, but
And you're correct. We do have what's called a worker error, and we have an recipient error. A recipient error would be something that they did not report that they were working or falsified, but it would still be considered an error. So the state does quality controls, and they pull a certain percentage of cases for the state, and that's how they come up with their error rate. Right now, we're at, I believe, 4.49 for Wisconsin. And we are doing very well as a county and as a consortium, as we work with the Moraine Lakes Consortium. But it will be, from my understanding, it's going to be an error rate across the state, depending on how that goes. But if somebody if a worker, right now we have what's called, the state has utilized what's called a PCR tool. So before a worker can, certain workers, we don't have everybody, we just have, because it'd be such a workload, we are checking cases before their food share is confirmed and going screen by screen by screen to make sure that what's in the case is correct. Of course, we can't gather every case because of the workload, but at least this way we're using these tools to find some of those common errors and correct them before the case is confirmed, and then it wouldn't be considered an error.
So in summary, or at least to play back, I heard you say there's two categories. One is the recipient, and one is the
What we call a worker error. Mm-hmm.
So, but it's incumbent upon the worker part to ensure the validity of the recipient. Well, if a recipient says, hey, I'm unemployed, but I'm not, and I'm falsifying my application,
right?
Whose obligation is to verify whether they're employed or not, or actually eligible or qualified?
We take their word for it. I mean, we have data exchanges, like if they're receiving a paycheck, we are able to see that if they're reporting to the state, then we have data exchanges right away while we're running the case that we can see that they've received a paycheck 3 weeks ago or 2 weeks ago. So then we would question about that. But if there's nothing in our databases, we have to take it that the person is reporting the truth.
Understood.
I mean, we question, okay, if you don't have income, but you're saying you pay $1,000 in rent, how are you making that? And sometimes it's just because they've recently became unemployed, or perhaps they have child support, or they're not making the rent, they're living with mom and dad, or they're living with something else. So there's a lot of questioning on behalf of the worker while they're taking that interview.
Understood. So kind of follow-up question. I thought I heard you say the state current error rate is 4.1?
4.9, I believe.
4.9. So would that mean state of Wisconsin, if this was November 1 of 2026, and that was the rate at the is it in arrears that they would pay? It'd have to be in arrears or is it quarterly? Do we know yet when that would be? And if so, if it is 4.9 come whatever, would that be 4.9 of that actual expense? So if it was $2 million or a million, let's make it easy. So roughly 5% of $1 million, state of Wisconsin would then have to reimburse the feds.
So right now, the sort of the baseline is 6% error rate. So currently we're doing well, right? So if they were to enact this tomorrow, Wisconsin is sitting at a good place. So it's about 6% before the federal government would look to the states to provide a cash match. And then there is a sort of a titrated sort of scale of if you have a 6% to 15%, you would owe this percentage of the money that we give to your state for cash benefits. So let's say the state of Wisconsin gets $500,000, obviously it's very low, or $1 million, very low, for all of our food share, and we had to give 10%, then we would have to contribute 10% for every $1 million. And then if the error rate goes up 15 to 20%, 20% to 25%, then that cash match that the state owes grows with that error rate. The difficulty, and as Renee said, our consortium, we're a 5-county consortium, and we do very well. Our error rate is very low, but we are not responsible for the other consortiums in the state. And so if other consortiums have higher error rates and ours is low, and then the average comes out to be above the 6%, then the state is on the hook. And so, the state has to plan for that accordingly. So when I indicated that Department of Health Services is requesting from a legislator $69 million, it's to cover the cost of assurance of keeping error rates low, and then this 50% or 25% match reduction. We had a legislative breakfast with our local legislators a few weeks ago, and I was led to believe that it's not looking promising. But again, that was just one senator. And there's a lot of work that the state is trying to do to talk with their legislators. So there's a lot of unknown at this point, but it is a reality that we'll have to determine how to solve in the future.
Supervisor Bossert.
So I like the accountability. I know people who are on these benefits, if they have a change in income, they have to report it. So if they're unemployed and then they get, say, a part-time job, they have to report it and their benefit would go down. Fail to, it sounds like that counts against our error rate. But if we later discover it and recoup those benefits, does it allow for that to adjust the error rate accordingly for the fact that we got those back?
Not that I'm aware of. From what I understand, when they did that quality check on that case, if it was wrong at that time, it would still be considered wrong.
Okay, but if they do the quality check in the beginning and it's right, and then later they get a job and they don't report that, does that then count on our error rate?
It wouldn't then, no.
Okay.
But, and if that's the case, we also do have overpayments. So if we find that somebody did not report, we do overpayments on people, you weren't eligible for these benefits. So then we recoup those as well.
Okay, all right, but so it's only really at the intake that they're looking at the errors.
Right.
Okay, all right, thank you.
You're welcome.
Supervisor Gelt.
Just a couple follow-ups, because you'll see where my line of question is. Part of it is ultimately the end game is how can we mitigate exposure, right? So I think you said, I understood, the federal benchmark is 6%. So if error rate goes above that, that's when the states would have to start kicking in.
Correct.
And is that spread? I think I heard you say it's also, or intimated, it's spread equally across counties, regardless of who may be at fault. So if Wisconsin is doing great at or Washington County, is doing great at, let's say, 1% error rate, and other counties are at 9, 10, 12, 15, we still have to pay.
So at this point, the way it's set up is the state would have to pay the cash benefit. And it's unclear if we got into that space, if they would pass that on to the counties who are evenly pass on to the counties evenly, or if they would pass on to the counties who are at fault.
So we've made many advisory resolutions to state legislators. Is that something maybe at a next committee meeting we bring up to put forward to the board to put through? Because why should we be penalized if we're doing our due diligence?
Right.
You know, we've done this in other departments where we kind of lead in the processing and showcasing skills and abilities. You know, can your department do the same for other county departments so that, you know, that's the mitigation part. So not unlike we paid, what, $1 million a couple of years ago, 4 or 5 years ago for new software to do just this, is ensure we're collecting all revenue and dotting our I's, crossing our T's. Is there, as part of that $58-some million ask of legislation, would that include any type of software upgrades that would help catch, you know, maybe there's administrative, you know, transposition, et cetera, that can happen, right? I get it. Input is input. Errors can happen. But is there anything else that could help catch the fraud? I think that Supervisor Bossert alluded to. Is there something known out on the market, you know, with advancement and interdepartmental relationships or exchanging database or AI? There's got to be a way to be able to pull, not unlike you said, a paycheck. Here's a system we're confirming. Oh, yep, IRS reports income. You had income. Sorry, you don't qualify.
So the system that we use is a state-run system, so I don't know the answer to that question 100%. Renee alluded to this PCR tool that we use as a spot check, and I know that one of the strategies that the state would like to deploy through this request that they're making for the funding is for additional staff to run every case through this PCR tool. In the conversation Renee and I had about it, it sounds very labor intensive and potentially boring for somebody as that's their job, and also doesn't get to your question about like fast automation, right? That sounds very laborious for an individual to be doing. But right now, that seems to be one of their solutions that they'd like to deploy.
So not in this budget cycle, but our next, sorry, we got a biennium, but if it's not already in 25 or 26, we might have to put money in as a placeholder. Or is that your intent? Or will you come back to the committee of the board and say, oops, Wisconsin is passing on this cost to us. We need to find how we're going to fund it.
Yeah, so at this point, the first area that I'm concerned about is this around $104,000 operational loss that we could have. My intent, if it's all right with this committee, is to wait to see what happens with the state and what they figure out. And then I would come to the committee probably a few months closer to this time next year, so July, August of next year, with a solution on how we're going to close that gap, either by looking at our own internal operations for economic support or looking within the human services budget overall to say, can we make a change or an adjustment so that we can cover this loss? Primarily, we want you to just be aware of this because in 6 to 9 months, we could be having this conversation. In regards to the error rate and whether or not the state would have to pay a cash portion of the food share, that all remains to be seen. And the federal government hasn't really given indication on, how they would go about doing that and when the start date is. And so, that would require the state to have information and then for the state to make the determination that they were going to pass that on to the counties. And so that would be a different conversation that we would have. And I would anticipate that would probably be further into 2027, potentially 2028. The idea that you have around an advisory resolution to say that, counties or consortiums should only be responsible for themselves, I do like that and would be willing to work with the committee on that if you wanted to do that.
That's good. Supervisor Troutman.
This is probably a very basic question that you've probably already gone over. But what if the federal government is doing a check are we not using the same program as theirs, or is it possible to use it so we can find the same errors as they do? How is that?
They, we don't use the same, but we don't check every case.
Okay,
That's
so
what it is.
But they are checking every case and.
So it's just a random,
Okay.
if we have 7,000 cases and they pull 10 a year and there was one that has an error on it, your error rate can go, if they have one error, if there's one error out of 10 cases, there's a 10% error rate right there. So, yeah. But they do pull more than that. I mean, for ourselves, yeah.
Sorry to interrupt
Mhm.
that line of thought. I just want to be clear. So what is their sampling size that they use to determine an error? Because that's going to be critical as well, as your point. If you've got millions of,
Right.
last I heard is what, 40 million Americans are receiving SNAP in some form?
Well, in our county alone, we have 3,745 households receiving food share.
So,
And their sample is small compared to that. I don't believe we have, I'm gonna say 4 a month. So it's not many. So if there's an error on there,
Supervisor Bussert.
So I like Supervisor Gallett's idea of an advisory resolution that would put the cost sharing for a higher error rate on those counties that have the higher error rate. And, otherwise, if you're a county right now that has a high error rate, you could look at this and say, well, all these other counties are doing good. We don't really have to focus on this. If they have a higher portion of that cost sharing that they're going to get hit with, that becomes a bigger incentive for them to tighten their belts and focus on this. And we talked about that PCR. How long per individual does it take to do that check? Is that a 5-minute process
it's
per person?
probably about I'm gonna say between a 10 and 20-minute process to check that
Okay.
case. Mhm.
Is it viable for each intake caseworker after each case to do their person through that? Or is that gonna put too much demands on their time? And
Well-
maybe that's something that you don't know offhand and want to look at.
Right now, we do have, we probably run, I'm gonna say 25 cases for that a week,
Okay,
so.
yeah,
Mhm.
so maybe
And we
that's
don't have,
something-
yeah,
Yeah, maybe that's something to take a look at, and the more we can control our own destiny, because we can only control what's within our.
absolutely.
But, if we control what's within our realm, that can help bring that overall average down a little bit.
Yeah,
too.
and what we're doing through that tool, it's not just intakes, it's gonna be anytime that cases, if somebody's doing a renewal, and anytime that case is ready for confirmation of benefits. So we're looking at it more than just the one,
Yeah,
than the intake.
gotcha.
Mhm.
All right. But yeah, I do like Supervisor Gallett's idea with the advisory resolution. So, yeah,
and, maybe part of that says, hey, look, if what you're doing is a best practice and other counties aren't doing that, is that part of the recommendation?
Mhm.
In addition to the funding or the liability part, let's call it, right?
Mhm.
Because
yeah,
I just can't stomach paying for someone else's.
high error rate.
Yeah.
Yep, I agree.
Yeah, I was just gonna say that in anticipation, maybe part of the legislative advisory resolution would be a component that was maybe as a pilot or whatever, that every time a caseworker's done, they run it through, just as an example, but not to dig into details, but we can take that up at our agenda planning meeting.
Okay. And so the other item for economic support, I just wanted to bring to your attention, I'm sure you guys have been watching the news. And so obviously it's front page news that effective November 1st, while the government is shut down, individuals and families' food share will not be active or accessible until the government reopens. And so obviously that's 2 days from now. And so anybody who has their Quest card or their EBT card that has money on it from their October benefits, they'll still be able to access those benefits. but their benefits will not load in November. And who knows if this goes into December, they won't load in December either. And so obviously, as Renee indicated, there's 3,745 households in our county that are affected by that will not be receiving their food share as they are expected for the month of November. And so that could have a very significant impact on, the health and well-being of, members of our community. Right now, the ADRC is running a food drive for Washington County employees. And so if you'd like to donate, you certainly can drop some stuff off at the Public Agency Center. But we just wanted to bring this to your attention because we are also working on putting out some public information on our social media, as well as working with United Way to try to engage some businesses to encourage folks in our community to make donations to the food pantries in our county as a way to help to mitigate this for folks in our community. We received information from the Full Shelf Pantry in West Bend that in September alone, they saw a 20% increase in the number of people coming to the food pantry. And that is before this, potential or actually real lack of access to the food share benefit. And so they saw in the month of September, they saw 1,200 people come to the food pantry. 450 of them were families. And so that's just one food pantry in our county. So I just wanted you to be aware of that. There could be constituents in your areas, in your districts that are in need, and we're just really trying to encourage the community to donate to the food pantry so that when people go and access those that resource, that they have something available for them.
Yes.
When you say 3,700 households, how many people is that?
7,086. And of those, 2,700 are children, and 50, just shy of 2,000 are elderly, blind, and disabled.
Going back to the error rate, maybe you said it, but how often do you check on eligibility?
We do for food share, we do an annual where they have to do an interview annually, but and then in between we have what's called a 6-month reporting form that they have to report those changes in every 6 months or confirm that things are the same.
Anything else? Good discussion. All right, thank you. Moving on to our next item, the co-responder quarterly update.
Yeah, so I'm going to ask John France, who's our acute care services supervisor and supervises our co-responder team to come on up. And because he helped me to put this great report together. And so I think the last time we talked to you about our co-responder unit, we indicated that we wanted to come quarterly and present to you to the data that we have about their reach in the community. I will just highlight a couple of things that I think are very interesting. Obviously, if you look at the second page and you're looking at the utilization of the co-responder team by the local law enforcement jurisdictions, you can see that the sheriff's department almost completely utilizes the co-responder team. Makes sense, right? They're located there, they're co-workers. But we are not seeing the utilization of the other local law enforcement districts. They're continuing to access acute care services, which is fine, right? We want them to continue to access acute care services, but we would like to see this shift. So while we're seeing the productivity of the teams in the area that we would like, we think that they're really making an impact in the community. We think that they're meeting the needs of in the community in a way that no other team is doing so. We really would like our other law enforcement partners to utilize Crew more frequently. We do plan to go to the Chiefs meeting in November to have another conversation with them. John has done a lot of work with the chiefs and the law enforcement. His team has gone out and done trainings and conversations and encouragement for local officers to utilize our services. And so we continue to work on that, and we hope that we will see the impact and the increased use, that we know will be beneficial to the community. On the third page, you can just see a number of just sort of vignettes or stories of different interactions that our teams have had with people in the community. We thought that that would be helpful for you to get a real life sort of experience of how they're helping people and what they're doing. So I'm going to stop there. I don't know, John, if you have anything you want to add.
I don't think so.
Okay, so we'll take questions.
Supervisor Bossert.
I appreciate the inclusion of the vignettes or stories. I think they give a lot of context to something I mentioned last time that you guys were here reporting, which is that sometimes we don't have numbers for those things that could have turned bad or would have turned bad, but didn't because of your involvement. So I think having these laid out like this, that gives a clear context to that. So I appreciate that. Thank you.
You're welcome.
And I would add kudos for spelling out some of the acronyms. So that's very helpful. There was one that I didn't know what ACS was, but as soon as Julie said it, acute care services, I figured that one out, but I didn't during the thing. But there are a lot of defined acronyms, which is very helpful. So can you to expand beyond acute care services? So Germantown Police Department decides not to use crew and they just take the patient to the hospital, or whatever is considered an ACS.
Like just a common case?
Yeah,
that-
just examples of acute care services.
Sure, yeah.
that,
So yeah, a lot of those, I think we see a lot of those cases, people, they have an emergency and so they reach out to law enforcement. It's very common. And so Germantown PD will respond. And if they have any inclination that there is a mental health emergency or unsafe situation that relates to someone's mental health condition, then they reach out to us. They're really good about reaching out to crisis in general. We are hoping that they will start reaching out to the co-responder team a little bit more frequently, but they reach out to us to initiate an assessment. And what we're doing in those initial contacts is just trying to get a sense of what led to the crisis. We're not going to diagnose anybody with a mental health condition in that sort of sense, but having a rough sort of estimate of what those symptoms are will help us direct towards one of the acronyms. And so not only then do we try to resolve that crisis with, a safety plan, some plan in the community to stay there, or a voluntary inpatient stay, but then we're trying to connect them on the back end of that crisis to try to make sure that they're connected to services to help prevent future crises from occurring. And so that is, in our mind, in the design of the co-response team, what we really hoped that they would fill with that clinical expertise. And I think we can do it in ACS as well. But I think that was the goal that we had hoped the co-responder team would really hone in on.
Thank you.
And if I can just add to, I think, so, ACS, our crisis team, they've been in existence for a very long time. They fulfill a need of somebody in crisis who needs that safety plan or needs that hospitalization. But we know that law enforcement interact with individuals and families in the community on all sorts of other things that also have a mental health or a substance use or a crisis sort of need, but it doesn't always rise to the level of what ACS does, right? Which is usually that Chapter 51 determination. We know that we have domestic violence. We know that we have family trouble, people who just can't seem to get along. And those are the cases that we really want crew to interact with as well, because it's not your typical state statute, chapter 51, chapter 55 situation. It's usually the things that lead up to sort of the larger crisis, the starting off with the family trouble, or I'm drinking too much and, or drinking regularly and causing a ruckus. And that's where we want law enforcement to really engage crew. And we're just not quite seeing that. We're seeing that in the sheriff's department, and they've definitely recognized the benefit and the impact of that. And we just need that to, bleed into the other jurisdictions. They've had enough opportunities and cases where they've seen it in action. So I would say each jurisdiction probably has seen it in action, but it's just getting them to call them for all of these types of cases.
For an integrated crisis system, you're supposed to have somebody to call and somebody to come and other things after that. If I call 988, will I have a crisis team come to my house?
Not necessarily. They are a
What's
separate.
the connection, and how does 211 fit in?
Sure. Yep. It's, I think the element of dangerousness is what is the connection. So, I think lots of people have rough days, they go through rough times, or they just need, who are the outpatient therapists in my area? And 988, 211 are really good at that. When you call either of those agencies, express some sort of thought about hurting yourself or somebody else, that's when they would start to consider the initiation of contact with us.
But not necessarily the local police department.
Correct. Yeah. Mhm.
Supervisor Gallitz.
So I get what you're talking about. So going back to the 6th law enforcement utilization CRU. So clearly West Bend for some reason isn't. Is it because of this whole posturing that they've had with the county in the past, and they said, "Yeah, I'm gonna thumb your nose at you," or is it they don't know?
And John could probably fill in more.
Sorry.
Yeah.
Finishing that thought,
Sorry.
it's clearly the other Germantown 50% of the time, Kewaskum 40, so they know it, they're aware of it. So to your point is, why aren't they using it more regularly? Whereas it's clear West Bend is saying, "Nah, we don't want to do this."
So I know in the meetings and the trainings and the conversations that John and his team have had, the chief of police has said it's open door, that officers can make those referrals, they can contact crew. So it's not that he's holding up or leadership is holding it up. So we don't know the answer to that, and which is why we're going to the chiefs meeting in November to have more of a strategy conversation about what can we do. Obviously, this is working. This is impactful. What's it going to take? Some of it is sort of adopting, a new practice, right? If you're an officer and you're working at 8 p.m. and you just can always call crisis and they're available, you just do that. But it's also thinking about your interactions in the community and the cases that they're dealing with in a different way, because they are sort of trained to think, oh, this is crisis, I'm going to call them out. But if you have family trouble and you're just trying to resolve that family trouble, what you should call crew as well, especially if you think there's some, impact. And so sometimes it's just change in practice. And I think, human beings are sometimes slow to change.
Yes.
How long has this been in effect, like say for the city of West Bend, that they've gone from 0 to 3.5% in that time? Like
A year?
how long has the program been?
A year?
Gosh, oh, it's only been a year.
No, so time is elusive, for sure. For sure, 2 years. We might be going into 3.
Yeah.
But to think about, we just did performance evals, so like.
I was just thinking of when the full team was available.
Yeah.
So.
What year is this? 25? I think. So it's all of 25, all of 24. I think we made our first hire towards the end of 23.
To your point about changing practice, so how can we convince the rank and file for West Bend law enforcement agency to see the value of it, right? And then value to them in their time, because that's usually a time, right? I got a whole lot to do. I got to pass this off. That's the reality of it. So how can, the narratives or the stories that Supervisor Bossert, can you do that in a different way from the perspective of an officer that sees the benefit of it? and is calling it regularly and says, oh yeah, this is, you know, and share those with the other law enforcement. I mean, training is one thing and know it's available, but what's the true benefit? What's a benefit to me? I think that's what's going to change the minds of the West Bend rank and file.
I agree. And I think that's the conversation we're hoping to have to sort of find out what do we have to do. And I think, you know, when we're having that conversation in partnership with, you know, the sheriff's department who helps us to co-lead this initiative, because, you know, sometimes officer to officer can, you know, work a little bit better.
I'm not even sure that I don't know that they might have an anecdotal like knowledge that they're calling ACS this frequently, but I mean, it's relatively new information to put actual information and numbers to it. And so part of me wonders that if we do you know, when we do have that meeting, if they will look at it and say, oh, wow, we did not realize that we were using it this infrequently, you know, and then that will help.
Yeah, and I would say, you know, and kudos to John and his team, because since the beginning of this program, we've been really wanting to, you know, data. What's the data we should be looking at? You know, how do we determine outcomes? You know, that sort of thing. And so, you know, to get to this point, to really now have some data to say, okay, here's what's working well. Here's where we need to do some continued improvement. I think is a good place to be at for any program. And so, you know, I'm not, you know, overly concerned like this is, you know, the end of the world, but it's good to have data to look at, to even have an understanding of the productivity of our staff, their reach in the community, and then where is it not taking hold? Because as you know, in the conversations that we've had regarding the budget, I mean, we're making a huge investment in this, and because we believe in it and we think that you know, it's going to be very impactful to our community, but we have to make sure, right, that investment is actually bringing forth, you know, what we hope to see, the fruition of what we hope to see.
So is the current team being underutilized?
We think that they could be utilized more.
Without increasing staff?
Correct.
Do the officers in most of our jurisdictions wear body cams? I'm just thinking of examples that they would be able to get from those to have someone for future educational purposes, like, oh, I never even gave that a thought. I'm the police officer in West Bend, and I didn't even think about this teenagers giving this father a difficult time, but now that if it's seen on body cam, that you could say this is something and the reverse, like here's a great example of it in work, you know, just something else that would be training.
Yeah, that's a really neat idea, actually. And I'm not aware of who all has body cams. I know it's it's becoming more and more common, but we certainly can have that discussion when we meet with them. I think that's a neat idea.
Yeah. All right. Any other questions? Thanks, John.
Okay, thank
nice
you.
meeting you. All right. Next agenda item, Riverbend update.
Yeah, so I do not have anything in your packet to look at, but I did say that I would come back every month and give you an update on Riverbend. So as you know, we have made that decision to close Riverbend. The provider has been put on notice. They have spoken with their staff, and so they are looking at winding down those services and being out of that building by November 30th. We have secured approval with Waukesha to enter into a contract for shelter beds. So we will contract for a female bed and a male bed in Waukesha with the same provider, with Norris and Mukwonago. And so we're just finalizing that contract to be effective December 1st. So that is moving forward. We have secured the appraisal. We finalized the appraisal, and we have secured a realtor with Emmer Realty, and so that has actually gone live in the last several days. So that is on the MLS where you post things that you're going to be selling. So so things are moving forward, and so we're just working with our realtor to determine if we can get a buyer for that property.
Any noise out there or?
I haven't heard, I haven't heard anything. I sent it to, we sent it to the folks who are running Samaritan to see if, there was some interest there. And then, to a couple other entities that we knew were looking for some type of facility, but I haven't heard if there's been any interest, but I believe it's just been live a few days because they took the pictures last week.
Any questions on that update? Thank you for continuing to do that. Appreciate that. Okay, our last item here is the state opioid response funding.
Yeah, so I have this agenda item on here. When I originally put it on the agenda, there was some concern that we were not going to get the state opioid response funding, which is money from the federal government that we receive through a grant. And so I thought I might need to inform the committee of a need to pull dollars from our opioid settlement fund. Thankfully, very shortly thereafter, we were notified that the federal government has released the state opioid response dollars to the states. And so we will be receiving that grant for this year. But I still thought, and in conversation with the chairperson, Supervisor Schulteis, we thought it would still be interesting for you to have some information about this grant because it is a grant that we apply for every year. And, things are changing rapidly at the federal level. And so that if in the next year we don't get that funding, this again would be the type of service that we would want to use opioid settlement dollars for. So we really just wanted to outline for you some of the services that we're providing through the state opioid response, a little bit about what this program is. And then one of the reasons for the holdup of the federal government issuing the dollars to the state was they were doing a re-strategic plan on how they want those dollars spent. And for some of you who may have been here about a year ago when we came and talked to you about harm reduction and the requirement at that time that we do harm reduction, and it can be controversial. And I know this committee, sort of the folks who are at the table at the time sort of wrestled with the concept of, I think we were talking about, paying people for doing clean urine screens and, things like that are sort of those behavioral incentives that, can sometimes be controversial or be hard to sort of understand, how they are beneficial. Now, the federal government is saying we cannot use this funding for harm reduction. So just wanted to give you this information again, just so that you're getting that education on this program, both, the services that we're providing, which I think are very impactful to folks who are struggling with addiction. And the fact that we're able to have this whole Suboxone Sublocade clinic where we're using this medication-assisted treatment, that without these dollars, it was something that our county didn't provide. And that type of medication is really impactful and beneficial for people to get through those first several months of sobriety when the cravings for a very addictive drug are pretty intense. So I'm going to stop there and just see if there's any questions about the report that we put together.
When does that start with the federal government?
Yeah, well, they have really fun timelines. So it's October 1 to September 30th. Yep.
Okay.
So for us, it goes between 2 budget years. And so that's where, it gets tricky because we've essentially budgeted it for 2025 and we were waiting for the last 3 months. And then, now we'll have money through the end of September of 2026. And then, you never quite know. It's always very last minute when they let you know that for sure you're getting this money. So, it's good to have on your radar in the event that we have to come and do, a quick request. It's nice that we still, that we're being, I think, conservative about our opioid settlement dollars because these are the types of programs that we really would want to continue if we didn't have another source of funding.
Questions, comments? Marietta's been quiet, so nothing from her. Okay. Well, thank you for that update. Always good to know, and congratulations on getting that grant.
Yes, thank you.
Yes. You know, that takes time and work and put in that. So our next meeting date will be to be determined as we run into some holiday issues. I don't think we want to meet here on Christmas Eve. So we're going to back into this and we'll be in touch with our next date of our next meeting.
Okay.
All right. This meeting is adjourned. I don't know when, in a couple of weeks. Julie and I.
Yeah, I
Yeah.
think we'll send out some potential dates for you guys to give feedback on.
Right.
I think it also will depend on, what agenda items I may or may not have.